I'm Simone Austin, the Senior Dietetic Advisor at Dietitians Australia and the Manager of the Advocacy and Policy team. And I just wanted to give you an update of some of the things we're doing in the advocacy and policy space, because there's a lot going on. One of them is continuing to update our members on what's happening with COVID, with restrictions and what that means in particular for private practice practitioners. So look out for the updates that are there nearly every day. It's also telehealth. We know that that's continuing now into the end of the year, and we're advocating strongly to try and have that as a permanent feature, particularly in the Medicare space. The review of the Australian Dietary Guidelines, we have our Dietitians Australia working group on that, and we've already put in our first submission. And the National Preventative Health Strategy, we've been putting submissions for those, and we've also been discussing with Acting Director of the Commonwealth Department of Health about what we feel is really important in this area. And in food regulation, particularly with Food Standards Australia New Zealand submissions, we're always looking out for ones that are relevant to us. So we've put in some around the FSANZ Act review, and that's really impacts the whole of the Food Standards Australia New Zealand review. So it's very important that we have our say in that and how it affects nutrition. Also looking at consistent labelling on fast food throughout Australia, the infant formula food safety and technology submission, and also the composition and labelling of electrolyte drinks. We have a bi-monthly meeting with Minister Colbeck, and he's the chair of the Food Standards Australia New Zealand Committee. So at that meeting, we're always able to bring up what we think is important for him to know about to ensure that health is on the agenda. The health and sustainable diets, we have put together a briefing paper that's been out for a few months and it's on the website, and we're nearly in completion to the position paper from Dietitians Australia. We also had a webinar, which was a free webinar on healthy and sustainable diets, and you can look that up through the Education Centre. It's still available, and we had around 360 registrations for that. So it's obviously a popular topic. We've also been invited to some forums, such as the UN Food Systems Forum. We keep up to date with CSIRO research, and we make sure we're chatting to these bodies. And CAHA, we've had a lot of input into their position paper that they're working on to make sure that it's really how dietitians see health and sustainable diets. Aged care, still a lot going on in that area. And with the Royal Commission handing down its findings and the government now responding to what they're going to do, we're really pushing that $10 extra a day on the basic daily fee, that the Royal Commission wanted to have a focus on nutrition. We're wanting to ensure that actually happens. So we're working with the Department of Health on what that looks like in reporting and what will be possible for aged care facilities to do that's not too cumbersome for them, but to ensure that it actually makes a difference in nutrition this money. We're also looking at having input into Cert 3 courses around training for people working in aged care facilities in the nutrition sections of those. Disability, still working on our grant. So we have the Co-Creating Safe and Enjoyable Meals project as well, working with the University of Tasmania on that, the UTS on that. We've had lots of meetings with state and federal ministers and Shadow Minister for the NDIS, Bill Shorten, where Robert and Sani Dalton went to Parliament House to meet with him just a few days ago. We've had about 10 different meetings to make sure that the ministers, both at the state level and the federal ministers, remember dietitians as part of allied health, because they often forget dietitians. And now we've really made them understand that in the independent assessments that are being reviewed and that most people are pushing back on, that if they are actually going to happen, that in the initial testing phase or the initial collection of information phase, that nutrition and dietetics and how people work with food must have some questions there to identify people who have nutrition needs and nutrition impairments. In mental health, we had our position paper is getting close to be finishing as well, or a consensus paper, depending on the flow of the evidence. We've had 3 different webinars come out, and we're also working on a few more. It's really an important area for employment for dietitians and to upskill us in this area of mental health, because we're pushing very hard for dietitians to be recognised as mental health practitioners as part of the Medicare Better Health Initiative. So we would like item numbers to ensure that dietitians can be part of that mental health care team. So if we do that, we need to make sure that we're upskilling dietitians in the mental health area. And then we have the area of member representatives and external committees. We have around 15 active representatives on 17 different external committees. So we're really ensuring that dietitians are on the agenda of anything that's to do with health. What have I left out? The Reconciliation Action Plan. There's NAIDOC Week coming up, and there are 5 free webinars. Please register for those. We also have online cultural capability training options, and we're making sure Dietitians Australia is following the Reconciliation Action Plan that we've committed to. So you can see that there's an awful lot going on in the advocacy and policy space. We'd really love you to get involved. There's a on the website now, there's an advocacy and policy section on the public website. It's also on the members website as well. And we're posting lots of things on SharePlay. So please, through your interest groups or just through your membership, please get involved. Thank you.